Hello and welcome. Thank you for your time and listening to the seminar on Ascension, Wisconsin's Bariatric program. My name is Christopher Weber. I'm an obesity medicine specialist and I serve as the medical director for Ascension, Wisconsin's Bariatric program. So first, what is obesity? I'm going to read one definition for you here. Obesity is defined as a chronic, progressive, relapsing, and treatable multifactorial neurobehavioral disease wherein an increase in body fat promotes adipose tissue dysfunction and abnormal fat mass physical forces, resulting in adverse metabolic, biochemical, and psychosocial health consequences. That's a long definition with a lot of big words. You don't have to remember that definition, but I read it to emphasize 2 points. One, this is really complicated. Losing weight is hard, and to do it healthily is even harder. Maybe you've heard the old recommendation, eat less, exercise more. Maybe you've tried it, and maybe it hasn't worked for you, and that's because of how complex this is. Every individual is different, and so at Ascension, Wisconsin, we like to work with you as an individual to have a personalized plan to get you where you need to be in a healthy fashion. The second point is that excess weight is associated with all sorts of other chronic health problems, and we'll talk about those in a few minutes. Other ways that we define obesity is based on BMI, so body mass index. Maybe you've heard of this. We take your height and your weight, put it into a calculator, and we get a single number. And based on that number, that determines your stage of normal weight, overweight, or obesity. So between 25 and 30 is overweight, and then anything over 30 is medically considered obesity. Now, we can also use body fat percent to determine obesity. That's a little more complicated. Our centers have devices that can measure your body fat, but it's not readily available in, say, primary care centers. And also the definition of what a normal and not normal body fat percent is not well defined. It's more of an expert opinion. But to give you some idea, for males, 30% or higher, and females, 35% or higher is associated with obesity. So as I said at the beginning, obesity and excess weight is associated with all sorts of other chronic medical problems. So for simplicity, we like to call these ABCDs, adiposity-based chronic diseases. And there are many of these. And a major goal of our program is to help you lose weight healthily so that you can prevent and reverse some of these medical problems to make you healthier overall. So some of the examples: type 2 diabetes, hypertension, high cholesterol, liver disease, coronary artery disease, heart disease, liver disease, and all sorts of causes of pain: arthritis, muscular pain, nerve impingement, depression and mood issues, heartburn, and even several types of cancers are associated with excess weight. So where does excess weight come from? Well, it's very complicated. It can come from many different sources. One is that our society is sort of made up to make us gain weight. Right? Over decades, we've spent more time in front of a screen. Our careers tend to be more sedentary than they used to be. And also easy access to high calorie dense food is another cause. But beyond these things, there's many other things such as genetics. Okay, so there absolutely are genetic components to excess weight. Now we look at this as a genetic predisposition, meaning you might be predisposed to have excess weight, but it doesn't mean you can't lose weight. And so we assess this with every individual, how much of a genetic component there is, and how can we tailor our program to help you lose weight in a healthy manner. And then also hormones. So there are all sorts of hormones that are involved in metabolism and physical activity and hunger and appetite. And these things can be all over the place and vary quite a bit from one person to another. And these are things that we assess when we work with you in our program. Okay, so what can we do about this? Okay, so the good news is that really a modest amount of healthy weight loss can reverse and prevent a lot of these ABCDs, these chronic medical problems that I mentioned earlier. So as an example, 5% weight loss can reverse many of these medical problems. So get your calculator out and figure out what 5% would be for you. And I think most people would be a little underwhelmed. It's not a tremendous amount where you can start seeing these health benefits. Now, a few of these weight-related medical issues require 10, 15 or more percent, but most of them 5 to 10% before you can see significant improvements. So to give you an idea, if we're using an anti-obesity prescription medication, we expect somewhere 5 to 15% weight loss as a minimum. Now, if we're talking about bariatric surgery, somewhere 60 to 70% of weight loss. Now, when we're comparing anti-obesity medications and bariatric surgery, it's a little bit hard to compare. When we're talking about surgery, we talk about excess weight loss. So you take how much extra weight that you have in the form of adipose cells, fat cells, and we're talking 60 to 70% weight loss with that. Whereas when we're talking about anti-obesity medications, we're talking about your total body weight loss. But either way that you look at it, with bariatric surgery, you tend to lose a lot more, a lot quicker than with the anti-obesity medications. And with surgery, you can expect reversal or improvement in greater than 90% of these weight-related medical conditions. What does our program look like? Well, at your initial visit, you'll meet with the medical provider, either the non-surgical provider or the surgeon, and they'll perform a history and physical examination, get your background, do the physical examination. You may have lab testing done. So some of these are fairly standard tests. So as an example, assessment of blood sugar, renal function, liver function, lipid panel, your cholesterol test, sometimes or often a thyroid test. Some other tests that we don't routinely do for everyone, but may be indicated for a specific individual is certain hormone testing, like the thyroid hormone test, cortisol testing, testosterone testing, and then other things as indicated. So maybe an electrocardiogram to look at your heart rhythm, and then other things if we need chest x-rays and ultrasounds and things like that. And then often we do the body fat analysis that I mentioned earlier, which is really just a fancy scale that gives you your total body weight and also body fat percent. And then our centers also have the ability to measure your metabolism, which I think is just fascinating and can be very helpful. You know, people worry, do I have a slow metabolism? Is my metabolism normal? What's going on with my metabolism? And this device is very simple. You sit, you relax in a chair, and you breathe into a tube and it measures your metabolism. So we can know, hey, what are your numbers? And that helps us prescribe a much more accurate and personalized calorie goal for you. All right, now, there are multiple paths to healthy weight loss. The four main areas we cover: nutrition, physical activity, behavior, and then the medication or surgery. So those are the main things, and our dietitians are critical for the nutrition part of things. And they work with you to develop a very personalized plan, because what we don't want to do is dictate exactly what you have to eat and when you have to eat it. I don't think that works long term. And so we work within your preferences to get something that is agreeable to you and that you can sustain long term. You may meet with a pharmacist who specializes in anti-obesity medications and over-the-counter supplements. And then after the initial consultation, you may or may not meet with a behavioral health provider on an as-needed basis. And then we do discuss anti-obesity medications. There's a handful of these with risks and benefits, and some are pills, some are injectable. So we go over the whole list of options for you to see if that's something that you would benefit from. So now changing to the surgical route, so similar to the medical route, you'll meet with the provider the initial visit, and you'll meet with a dietitian regularly. There are several different surgeries available. The vertical sleeve gastrectomy and the gastric bypass are the two most commonly done. Most of the time, you'll have 6 monthly visits before you're able to schedule the surgery, and you get all sorts of education during that time. You'll meet with the dietitian each of those visits. You'll learn how to eat healthily, how much to eat, what to eat, when to eat, and then how you'll have to eat afterwards, because it will be different long-term after having the surgeries. Your surgeon will go over the risks and the benefits, the expected weight loss, and then the long-term follow-up plan. And that is one thing I want to emphasize now. No matter which route you go, we want you to be successful long-term. If you remember that long definition that I read at the beginning, excess weight is a chronic condition that can wax and wane over time. All right, maybe you've experienced it. Maybe you've lost some weight and then you gain it back, right? Keeping the weight off is as hard. It takes as much work as it does to get there in the first place. And so we want to make sure that weight loss maintenance is part of your long-term plan. And so with either route, medical or surgical, we keep working with you. Anywhere from a few times a year to once a year, all person specific depending on how you're doing. Okay, and then to close here, why choose us? All right, so Ascension Bariatrics, we ensure that you're provided the latest options and all the options for healthy weight loss. We're involved in many state and national professional organizations. We participate in clinical research. We work with advocacy groups to ensure that obesity has adequate attention and to promote treatment coverage by insurances. And we also have a network of specialists. We work with sleep medicine specialists, endocrinologists, and many others who have a special interest in obesity medicine and the related medical conditions. All right, so I thank you for listening. I hope this is educational and you learned something. You know, we've had the pleasure to work with thousands of people at our centers over the years, and we look forward to working with you.